It is a disease that can strike anyone. Children are its victims.
It was like the scariest day of my life.
And adults of any age.
My doctor said, I have something to tell you. It was pretty scary.
No race, religion, or background is immune. Even the wealthy, the powerful, and the famous cannot escape it. Bond trader Michael Milken couldn't. Former Senator Bob Dole couldn't. Nor could singer Olivia Newton-John.
I want to help women who have gone through what I've gone through.
All of these individuals have had cancer, a word that for many symbolizes dread, desperation, and death.
I just thought that I was going to die. I'm frustrated that there's no cure.
But not all cancers are incurable. Tour de France winner Lance Armstrong hopes that his testicular cancer is in remission for good. Les Willig overcame his lymphoma 30 years ago. Bill Conklin and his family have been living with thyroid cancer for years.
I had my surgery 20 years ago, and I'm still here, and I feel fine. A whole bunch of them in there, huh?
Bill's daughter Mackenzie was diagnosed in 1999 with the same cancer and has had surgery. In all, 11 of Bill's 33 relatives have had thyroid cancer, including his father, his brother, 2 of his sisters, and his uncle, Steve Conklin Sr.
Okay.
I always figured someone would get it, but we never know who or when it would hit.
Did all these people have bad luck, or was it something else? Why do some people get it and others don't? Can cancer be inherited? Why is it that some cancers can be cured while others can't? Finding the answers has been likened to putting together a jigsaw puzzle composed of thousands of pieces when you don't know what the final picture will be. And making it all the more difficult is the fact that cancer is not one disease, but a disease in many forms. How it is diagnosed and treated depends on where in the body cancer strikes.
Say, ah. Great. Okay, smile and show me your teeth.
10-year-old Zaylene Galarza has cancer of the bone marrow, known as acute lymphocytic leukemia, the most common type diagnosed in children. She is enrolled in a clinical trial, a scientific study of her disease.
I want you to squeeze my hand as hard as you can.
Today is the end of the first phase of her treatment, known as induction.
Today's day 28, right?
Day 28.
Yes, today's day 28.
Day 28 is when her oncologist, Dr. Kelly, will find out if the chemotherapy is working.
You ready? We're going to count to 3.
A portable catheter attached to Zaylene's chest is used to take blood samples and deliver a combination of chemicals. One of them has the side effect of stimulating her appetite.
She's upset because she's going into the OR today. The days that we go into the OR, she has to fast.
Come on, Mom. We're going to room out.
In the operating room, Dr. Kelly will extract a sample of Zaylene's bone marrow, the source of her cancer. After Zaylene is anesthetized, a spinal tap is performed.
As much as you can put her knees up, that would be terrific.
A dose of chemotherapy is injected directly into her spinal fluid.
It's the chemotherapy that's going in there.
Then to find out if the chemotherapy has killed the leukemia in Zaylene's bone marrow, a sample has to be extracted.
Yep, that's marrow. I fully expect her to be in remission today when we look at her bone marrow. What that means is, when we examine the bone marrow under the microscope, we see less than 5% leukemic cells present.
50 years ago, childhood leukemia, cancer of the bone marrow, was 100% fatal. Now, 80% can be cured. How did this happen? One of the reasons for this remarkable breakthrough is that extracting samples of the bone marrow to study its response to treatment is a simple procedure. But cures for many other cancers have come at a slower rate, in part because of where they attack.
I had 5 weeks of radiotherapy, and at that time everything seemed to be completely under control.
Maggie Duke and her doctors thought that her breast cancer was in remission. Her x-rays and scans showed no sign that the cancer had spread. Then during a routine operation to remove a cyst, she was told of a terrifying discovery.
During that operation, the young surgeon saw that there was a nodule on the liver, and this was a sign that really this breast cancer had not been under control.
For a researcher to study other tumors, such as those found in the breast, the liver, or the brain, would require repeated and possibly risky surgery. This inaccessibility has slowed progress and frustrated cancer specialists like Dr. Helene Brown.
For those cancers that affect our organs that are fairly well hidden inside, you're really working in a blind area. You can't touch that tumor every time you want to try something on it.
For years, people like Maggie, who wanted to monitor their cancer or who wanted to find out if they had cancer, were faced with few or no options.
We'd have this 4 or 5 hour test where you're laying flat on your back with an IV stuck in each arm, and they would inject the calcitonin into you.
Steve Conklin is still haunted by the memory of the calcitonin tests he and his children had to undergo for thyroid cancer.
And then it wasn't even sure if they had it. You know, it wasn't a positive test.
What Steve and his family hoped for was a day when an accurate and simple blood test would tell them if they had cancer.
Those are patients who have molecular evidence of their disease still persisting.
Like the one Professor Jerry Radich of the Fred Hutchinson Cancer Center has devised, not for thyroid cancer, but for leukemia. With this test, he hopes to answer a vexing question faced by all cancer patients. Is it possible to predict a relapse, even though there is no microscopic evidence of cancer in the blood?
Whereas a normal pathologist may be able to detect leukemic cells in 1 out of 20 normal cells, by our technology, we can really detect one leukemic cell in as little as 1 million cells.
Using this method, Dr. Radich hopes to find the critical point between 1 and 1 million cells at which full-blown cancer returns. Finding the answer could allow doctors to treat patients earlier and save lives.
And these studies hopefully will allow us to really design better therapy and distinguish people who have disease but have such a low burden that they're at a low risk of relapse versus those people who have a disease burden that's increasing and are destined to relapse.
Radich's research is grounded in the belief that by monitoring and treating it early, cancer can be treated as a chronic illness like diabetes. His work, a small but vital part of solving the cancer puzzle, is the continuation of the systematic study of cancer that began 50 years ago. Back then, only a handful of doctors believed it could be cured. Dr. Emil Frey was one of them.
I would say that the scientific community didn't think that cancer was challengeable, that is, it was too complex.
Frey and his fellow researchers not only showed that the uncurable could be cured, but it inspired thousands of other researchers to join them and become cancer killers.
If I may, I would like to ask you to do 2 things. But before I do, I would like to show you something. Watch. This is a normal cell. See how it divides evenly into 2 parts. This is normal. Now watch this abnormal cell. It literally explodes, ripping itself into 2, 3, even 5 parts. This is abnormal growth. This is cancer.
Cancer, in its simplest form, is uncontrolled cell growth. In an organ, it results in a tumor, which is a collection of runaway cells. Getting rid of the cancer means getting rid of the tumor.
Now, this is the lobe of the lung that we have just removed, and you'll notice how delicate its structure. And here, the tumor mass, the cancer.
The word cancer comes from the Greek word for crab, the description the ancient Greeks gave to the crab-shaped tumors that formed on a woman's breast. To remove them, the Greeks used a crude form of surgery, and for the next 2,200 years, surgery was the only treatment for cancer.
Prior to 1955,